Okay, more practice on drug dosages. In these questions, we bring in the medication orders that you learned in 6.1. So, in addition to all your other worries, you have to decipher what things like this mean. So, let's see if we can handle this. Uloric is a drug used for treating gout. Your hospital stocks it as 40 milligram tablets. So, at some point, probably we're going to end up using the fact that there's 40 milligrams of medicine in one tablet. We'll just hold on to that for now. Ellis has prescribed Uloric 80 milligrams POQD. What is all this? Uloric is the drug name, of course. 80 milligrams is the size of a single dose. When there's a number in this, it's basically always the dosage amount for a single dose. PO is by mouth, means eat them. QD means per day, as in once per day. So you only take this stuff one time every day. There's no multiplying by 2 or 4 or anything like that. So for a single dose, Ellis will take 80 milligrams. But wait, they don't want milligrams. They want to know how many tabs. And that's where this thing comes in. Let's do a cross multiplication and see what we get. 40 milligrams. By the way, if you've already done this in your head and seen that the answer is 2, you're right, but I'll do it by cross multiplication because we don't want our skills to rust. Okay, so there's 40 milligrams in one tablet, so 80 milligrams would require how many tablets? 1 times 80 is 80, divided by 40 is 2 tablets for a single dose. Question B is, okay, if a dose is 2 tablets, then how many does he take in a whole day? Which is a tiny bit of a trick question. How many doses are there per day? Just 1. QD means just do this once a day. So in a whole day, he only takes 2 tabs. In a week, short answer, multiply by 7. Long answer, if you take 2 tablets in one day, then you take tablets in what should go here as a week, but I have to write it in compatible units, so I'm going to say 7 days. 2 times 7 is 14, divided by 1 is 14. A week's supply of tablets for Ellis is 14 tablets. Xifaxan is an antibiotic used for treating diarrhea in patients 12 years or older. Your hospital stocks it as 200 milligram tablets, so 200 milligrams per tab is a good thing to know. Standard Xifaxan treatment is 200 milligrams POTID 3D. So, this is the size of a dose. PO means this is something you swallow. TID, you know that one? BID is bid, is twice a day, sorry. And TID is 3 times per day. So 3 per day. And the 3D is the length of the course of treatment. That's 3 days. So take 3 of these every day for 3 days. How many tablets will a patient use in a standard treatment? We have to figure out how many in a dose. Then we'll figure out how many in a day. And then we can figure out how many in the whole course. So starting with the dose is 200 milligrams. We could do a cross multiplication, but in this case, we catch a break. The tablets are exactly 200. It's like the company actually knows what the standard treatment is and says, you know what, we'll make 1 pill that's exactly what you need. 200 milligrams is exactly 1 tablet. You know, I'll set up the cross multiplication even though it looks a little silly. If you solve this by cross multiplication, you would look at the tablets and say, okay, 1 tablet contains 200 milligrams. And then you'd say, okay, I'm trying to get 200 milligrams into my person. And you'd write X tablets here. If you're tired and short on coffee or something, maybe you could be foggy enough to not see what's coming here. 1 times 200 is 200, divided by 200 gives you 1 tablet. So yes, even for silly examples like that, you can use cross multiplication and it will work fine. Each dose is 1 tablet. Now, in a day, TID means take 3 doses a day. So times 3 means we will take 3 tablets per day. It's 1 tablet per dose, 3 per day. And the course of treatment is 3 days, so times 3 again. That means the entire treatment, 4 tabs per course. If the pill company is really clever, they will make a package that has exactly 9 tablets in it, and that will be just perfect for people who are getting the standard treatment.